Medical advancements are making life easier for some people who live with sickle cell disease.
Although the genetic blood disorder is rare, it can lead to health complications and debilitating problems for patients. Angelique Arentok spoke with experts and advocates about new treatments in the field of gene therapy.
Sickle cell disease affects roughly 100,000 people in the U.S., according to the CDC. Doctors say the inherited blood disorder affects the Black community at a higher rate.
It causes major problems not only with the blood, hence the name anemia, but it also causes these severe painful events intermittently. It causes strokes, it causes heart problems, lung problems. It affects the entire body.
CHKD's Dr. William Owen says the field has long relied on bone marrow transplantation as, quote, transformative therapy with curative intent. But in December,
this was huge.
The FDA approved 2 types of gene therapies to treat patients ages 12 and up with sickle cell disease.
This is not a simple medication. This is a transplant, a type of transplant called autologous transplant, where you get your own cells back that have been modified in the laboratory.
The results so far impress him.
What both studies showed were 86 to 94% improvement or resolution of painful events in the year to 2 years after receiving these therapies.
CHKD is working to get hold of the means for gene therapy to help patients locally. But Dr. Owen knows of one in Hampton Roads who was part of a clinical trial.
He had normalization of his blood counts, no painful events, and back to a normal life.
Dr. Owen says scientists will have to keep studying other therapies and monitor whether negative health effects down the road form. Other things to consider are access and cost.
Estimates are $2.5–3 million per patient. But if you look at the lifespan of a person with sickle cell disease, the cost of taking care of them and the loss of productivity of their life, not to mention their life activities, is much more expensive.
Advocates for awareness like Suffolk teen Ayanna Johnson feel hopeful.
My one thing would just be really focusing on trying to, again, lower the cost, because even though this is a great thing, you have to think about how much is this going to cost out of pocket for patients who can't even afford simple medications.
Ayanna, who lives with sickle cell disease herself, is also focused on getting the word out about donations.
There are people who have sickle cell disease that need blood transfusions as many times as just once a month. It's really important that we take the time to donate blood, especially in communities of color, Black and brown communities.
For sickle cell patients, the best donors are donors from their own race.
Beth Eads with the American Red Cross says the more donations there are on the shelves, the better.
Some patients develop antibodies towards donor red cells, and in that case, their blood has to be more specifically matched. And so that's what we do, is find those specific matches for the patients. But the only way you know if you have that profile is to come in and donate so that we can test you.
In Norfolk, Angelique Arentok, 13 News Now.
And you can give blood at the Norfolk Donation Center near downtown. Doctors also recommend you enter the National Bone Marrow Transplant Registry. To find helpful links, head to this story on the homepage of 13newsnow.com.